Hi, everybody. My name is Dr. Ann Hill, and I am excited to invite you all to our podcast. This is either going to be our first or second podcast. I'm not sure yet, but Dr. Ilana Gurevich and I both teach neural therapy, and we are extremely passionate about it. And we wanted to start a podcast to interview people who do neural therapy and how it has been a huge game changer for their practices and for their patients' health. So, without further ado, I would like to say hello to Dr. Gurevich. And Dr. Gurevich, I'm going to actually just have you do your own intro. So, please tell us about yourself.
So I am a naturopathic physician, acupuncturist, and board certified naturopathic gastroenterologist. So what I really do in my practice is I focus on GI health. And it's an interesting thing because me and Dr. Hale run very different practices, but we're both using the same modality really effectively in our private practices. And that's neural therapy, which is it's not where I thought, it's not the type of medicine I thought I would be doing when I originally got into medicine.
Can you tell us a little bit about how you got into medicine? Speaking of which,
Yeah, so I think like a lot of other naturopathic physicians, it starts with a very personal story for me. I at the age of 12, I started having symptoms of chronic GI issues. My parents were physicians, they were both psychiatrists, and so at first they thought I had like what they would call a nervous stomach, and then they took me to a variety of different physicians. I think I went to 5 different gastroenterologists. I went to a physician who specialized in eating disorders, but I was dealing with chronic pain, chronic diarrhea. I couldn't gain weight. I was, always tired. I was just not thriving. And at my fifth gastroenterologist, she finally decided to scope me. So I think I started having symptoms at age 12. At age 19, she finally did a colonoscopy. And what it turns out I had was Crohn's disease. So I had Crohn's disease in the terminal ileum. This was the late 90s at the time, just to date myself. Um, and there was not a lot of drug options back then. And so two things happened at the same time. One is they started me on very, very high dose steroids. They started me on 60 milligrams of prednisone. At that time in medicine, we only had three prescription options: steroids, 6-MP, which was a cancer drug, and then mesalamine, which is a non-steroidal anti-inflammatory. All of those are still utilized in inflammatory bowel disease, but not very, like, they're not really, we utilize biologic medications a lot more. They just weren't available for IBD back then. And so at the time I was hospitalized, she started me on mesalamine. I was hospitalized, and coming out of the hospital, my dad, who I think we'll actually end up interviewing him on the podcast, he was going through his midlife crisis, which was discovering alternative medicine. And so he was discovering acupuncture at the time. He was an addiction psychiatrist as one of his board specialties. And he was working with an acupuncturist who was also attending naturopathic school. And so I got funneled into this naturopath's office. And I remember I was on steroids, so I was, very emotional. Like everything was like right on the surface. And my dad had put me on all of these supplements because he was just starting to play with alternative medicine. And I went in to see the naturopath, who he was, I mean, I credit him for saving my life, but he took my 19 supplements and he pulled 2 away and he replaced them with 4 other supplements. And so then I had this emotional breakdown where I was like, this 19-year-old child carrying around the pill holder that was like the big pill holder that 80-year-olds use, not like the average pill holder. But this naturopath said, give me a year of doing what I tell you, and I promise it'll make a difference. And a year later, I was living abroad, studying abroad. I was no longer emaciated. I didn't look like a cancer survivor. I had actually gained weight. And I was actually like, I was alive and I was going out dancing and I was partying and I had energy for the first time in my life. And while I was studying abroad, I was living in Scotland. I got introduced to this person who was also, he had the same diagnosis as I did. He had Crohn's disease, but he was on a all liquid diet. It was an elemental diet. And that's all he'd been able to drink for 4 months. He couldn't leave his house. He was like dying from the inside out. And I remember there was something about that moment in time where I had never been so healthy in my whole life, and talking to this person that was so sick, that I realized, oh, this is the medicine that I want. This is what I want to do with my life. I didn't know until that point And so then I returned to my undergrad, from my study abroad, and I just dove into the sciences. And I started doing all my prerequisites to go to naturopathic school.
Wow. Thank you for sharing that story. Tell me a little bit about how you got into neural therapy. And this might involve your dad.
So it does involve my dad. So my dad, I mentioned, is a psychiatrist, and one of the things his practice is really very complicated people. He also happens to be one of very few psychiatrists who specialize in getting people off of medication. Psychiatrists are really good at putting people on meds. He specializes in getting people off meds. And one of the things he watched the data coming out of the VA on this one particular injection called the stellate ganglion. And this is an injection that the VA has published data on that shows high efficacy for PTSD. And what he wanted to do is he wanted to learn on how to do this injection. And that kind of, took him through this cascade. He also studied with the teacher that Anne studied with. But what he was starting to realize is there is this discipline of neural therapy in the US that stems from this one physician who used to practice here, Dietrich Klinhart, and people who he taught. But in Europe and in Latin America, there is this abundant culture. And so what he started doing is he started bringing out educators from Europe. Originally, it was from Europe to teach this neural therapy curriculum. And he was my dad, and we live on opposite ends of the planet. And so he basically was like, Ilana, come study. Class is free for you. So what I would do is, and I actually gathered a bunch of my peers from the West Coast, and we would fly back east to sit in these trainings. And I think it was like a 200 or 300 hour training by the end of it. And so that's how I dove into neural therapy, mainly because my father was like, this is a valuable tool. You should learn it. And so I would go back, and I would go back east, I think 4 times a year. I remember my babies were little at the time, and I would have my little one on, like, in an ergo, walking up and down the aisles on the red eye to fly back to dive in to get this training. And I don't do psychiatry, like, that's not my specialty, but I was able to implement this same set of tools onto my chronic gastro patients with the same amount of efficacy.
Thank God for your dad. He's
Mhm.
amazing. Tell me a little bit about like when you started practicing neural therapy in your practice. Like what were some of the things that you took home from those trainings that you started integrating right away and that were helpful?
So, I think the most important thing after you get trained, and this is what both me and Dr. Hill will tell our patients, or not our patients, we'll tell our students time and again. The most important thing is to implement the injection as often as possible right after you're done training. And that's a foundation of the how we run our courses. Is what is the first level one is what is the lowest hanging fruit that it's so easy to implement from day one. So that's what I did. From day one, I would come back thinking in injections. Somebody would give me, present a clinic with X, Y, or Z, and I'd be like, okay, what are the interference fields? What am I looking for? Where are the scars? And I would just start from day one injecting right away. And that's really important because there's what you learn didactically. So there's what our students learn from just our patient experiences, and some of our teaching assistants patients experiences using these injections. And then there is, what are your patients telling you? Like, how are you taking this skeleton and putting the meat on the bones so that you understand the power of this injection? What can it do? And one of the things one of my teachers taught me was, I asked them to report back to me how they're feeling at 48 hours after the fact. So I would talk them through the injection, get them to sign the consent, do the injection, and then could you please just send me an email in 48 hours so I can understand what this injection does? I think that's the most important take home for new neural therapists, is do it and have them report back when it's fresh, because that teaches you the tools of that injection.
Can you describe a little bit more like for you like what was some of the low hanging fruit? Like what do you think about like what's like oh this is what I want to do?
So, scars are always Super important for, so I am GI, my practice is GI based, right? Like probably 80% of my patients have some kind of GI complaint. They might have other things too, but there's a GI component there. If you're looking at scars, a lot of them are, in my practice at least, abdominal scars. And so what happens with a scar is the tissue doesn't heal. Normal physiologic tissue, the skin is with the skin, the fascia is with the fascia, the muscles are with the muscles. And with scars, all of the healing process has all of those things getting intermixed. And so the tissue is just gunky. I think like gunky or like sticky is a really good way of describing it. And then what happens is the intestines, which should move like, wax paper and butter in between it, it doesn't. It like gets stuck, and that affects all of digestion. That also affects everything else that's on that nerve pathway. And so the lowest hanging fruit, and I think every neurotherapist will tell you you have to start with the scars. That's like visit one is always starting with the scars. After that, we teach a lot of different other procedures or other ganglion specific injections that allow you to kind of turn on the organs just by like superficially hitting them or deeper hitting them.
Can you talk just really briefly about what, like if someone's going to go in and get neural therapy, tell a little bit about what does an injection look like? What's like a scar injection look like? Or
Great
what
question.
is, like if someone's going to deal with adhesions, what does that look like?
Great question. So I'll tell you what I do, and then probably you do something a little different. Okay, so let's just say scars can be long or short. Laparoscopic scars are pretty small, and then hysterectomy scars or like breast reduction scars are really long. What I notice, or what the worst scar is, a tummy tuck scar. Have you injected those?
Mm-hmm.
That's like a long appointment. That scar is long. Sometimes it goes 180 degrees, from hip to hip. Sometimes I've seen them go almost all the way around. It's a bad scar. But so what we're doing is we're inserting a needle pretty transversely, to be honest. And what we're doing is we're trying to hydrodissect, right? So we're using the procaine, which is the local anesthetic of choice, and we're injecting it transversely into that scar. And what's happening is when you're putting the procaine into there, it pulls apart. So it pulls apart and breaks down some of those adhesions. I am personally also ozone trained, so I will also add ozone into virtually all of my scar injections on top, just to have more dissection. And then also, ozone's really good at eating up inflammation or like eating up chronic infection in there, so it just brings that to the next level. And so that's where I would always start is with that scar in particular, with and scars in particular.
It's pretty fun, I think, as a neurotherapist. You just start thinking in terms of scars. Like, oh, that's one of the things I always ask now. What are all your scar tissues? And then that helps me kind of ask more questions that maybe
Yep.
didn't even come up in the intake form.
And then
And
the other thing I want to point out is I will, if a patient is in the office, and I definitely since COVID, I've been a lot more virtual, but if a patient is in the office, I'm doing an abdominal exam, right? I'm looking at their abdomen, I'm looking at their body. It's interesting to me how patients don't even know. I'm like, what's this? What's this scar? What's this scar I'm seeing? And patients are not necessarily aware of what they don't remember it.
mhm, yeah. Tell me, in your practice, like as someone who focuses on gastrointestinal health, is there one injection that you do the most? I mean, and maybe you can't even say that, but
Yeah.
is there one that you do the most, or is there one that you feel like is been the most helpful for your patients?
So I have a GERD protocol, which is one of the things that we teach in level one. That one is very effective. It's a series of one, two, three injections, one on the anterior side and two on the posterior side. That one I use a lot for reflux patients. The other one that I use a lot is what I call, when we teach it as an small intestine asher. So I'm also Chinese medicine trained. I also have a master's in Oriental medicine, and asher in Chinese translates to right there. And so one of the things that I use a lot in practice is I'll be doing my abdominal exam, and there'll be areas that I feel have like the best way I can describe it is like a neuromuscular adhesion. I think that's something that one of our students actually at one point brought up. That's how he worded it. So I'll be doing the physical exam and I'll be like, ah, sure, right there. And then they'll be like, I have pain right here. So that's an injection that I'll do a lot. And then, you know, I think where women are the ones who tend to come into the doctor more. They're the ones who tend to take care of themselves. And so for me, I would be hard pressed without the pelvic congestion. That is an injection. I think probably that's the injection that I do the most of. Personally, I also for my body, that injection is immensely helpful.
Hmm.
And so that is the other reason why I'm so drawn to it, because I have had that particular injection like reset my night sweats or reset my dysfunctional periods when my periods got out of whack. Like in my body, that's a very, very useful injection. And so when I learned an easy way to do that injection, it like changed everything.
Cool. Okay, I'm going to shift gears. Can you tell me a little bit about teaching neural therapy? Tell me how you got into teaching and why you teach neural therapy.
So I had a really, really, really good training. Like I felt like the teachers we brought out from Europe were incredibly clear and very, very useful at educating, right? And so that was a big part of it, is I really appreciated that. The other thing is, when I would sit down and talk to Anne in particular, it was interesting how we had different trainings because we had different teachers, and there was like a sweet spot that we could find. So when Anne approached me to say, "Hey, do you want to do this teaching thing?" For me, I was like, "This is such a useful tool in my practice." There is the more people we can teach, the more basically needles we can get into the hands of qualified providers, the better for humanity. I mean, really, that's kind of how I feel. Like we hold so much in our nervous systems that we don't even realize. And when you open up the door using this injection, it is a little bit of an intense technique to like it opens up the door to move things that people have been shoving and not paying attention to and walling off. And when you move that, you just end up with healthier people. And that I think, I didn't go into conventional medicine. You know what I mean? Like I wasn't, I was, my passion is to give back to this medicine that gave me a life. Like I think naturopathic medicine saved my life. And the more I can empower more of our people to offer that to humanity, I do think it's a service. How did you get into teaching, Anne? I didn't.
I just love teaching what I love to do. So that's why I got into teaching cranial. And then as soon as I learned neural, I was like, this is something I'm going to be teaching. I just know it because it's so useful and amazing. So, yeah. One question I wanted to go back to your practice. You also do acupuncture. So, can you talk a little bit about how you pair neural therapy with acupuncture?
I think it pairs beautifully because I think that it's really important after an injection that patients quote unquote marinate. Like there are so when you're dealing with the detoxification of emotions that happens after you inject, what happens is it comes in waves, and some of those waves are really, really close to when you inject. And other waves take days to unfold and unravel, right? But I think it's important that you're not just, resetting the nervous system and then having patients like, zoom out and go back to a meeting or hop on Zoom for another 7 hours or, go shopping and doing 1,000 things. Like I want them present in their body. And so what I tell patients is that when I do my injections, I call them the mean needles, because I'm putting something in, it's like going to cause, it's a little bit more intense. And then I want them to marinate. And so I have them marinate with what I call the nice needles. So I'll do a Chinese medicine acupuncture um, prescription. So I'll put in needles and I'll just let them lay and sit and marinate in the changes of their nervous system so that I feel like it helps their emotional body actually hold longer. And that has been a very useful tool for me. I don't have a hands-on tool besides that, but that lets the patients get a little bit more out of that injection.
Cool. Okay. Can you, lastly, can you tell us a little bit more about what you're up to these days besides creating a new podcast?
So you can find me. I just launched a new clinic, actually. We've been up and running for about 3.5 months. You can find me at openwellnesspdx.com. Well, I'm in Portland, Oregon, just like Dr. Hill. And really, I think that what I'm inspired about now, which has always been something that fuels me, is I run a busy private practice, and I also train residents. And so I'm able to train a gastrointestinal focused new class of naturopaths and acupuncturists who are out there just really, giving support to more patients and bringing about change through these gentle corrections on the human body that makes people more healthy.
Great. Thank you so much for talking to me today.
Thanks, hun. Bye.
Bye.